Portion of the news for New American Funding. The biggest study ever on the impact of head injuries to football players found that 110 out of 111 former players had some form of CTE after they passed away. They studied more than 200 brains overall. The percentage of players with symptoms, similar numbers. Bring in Dr. Rob Dickerman, a neurologist from Neuro, Texas, on the KRLD Newsline. Dr. Dickerman, there's no way that no one could possibly have thought these numbers would be this high.
No, that is a surprising statistic. And the study that was published in the Journal of American Medical Association this month has great data. The scientists involved are very reputable. One portion of the study that they mention is the possibility of a bias, because if my son's playing football and he's in an NFL and he has a severe brain injury or whatever and dies, and I donate his brain versus other players that played for several years and never had theirs donated. So, I mean, you know, most of these cases could have been families that donated their loved ones' brains because they were concerned about specific injury. So we're only looking at 111 brains that were donated, of which how many were donated for that reason, for the suspicion of dementia or whatever else. Obviously, if we could have a survey of 500 football players randomly who donated their brains, it would be a better idea of what the actual percent that's occurring.
When you stretch it out to 200 players that included college and high school players, the percentage does drop, but it's still extremely high.
It is, and the questions that I have to ask, and I'm not by any means saying their data is not good. The question that I have to ask is how many were genetically predisposed. As you and I discussed before, there's a gene, the E4 gene, that's related with Alzheimer's, that's also connected with CTE. So they don't have that data yet to clarify, but I will agree that of 111, 110 showed the signs of CTE. It's alarming.
Not all of them necessarily show signs of this.
No, exactly. So clinically, and that's where the gray area is. The CTE used to be called dementia pugilistica, because we mainly focused on boxers that were called punch drunk. And now when we look at what the neuropathologists have come out to say, this is how we diagnose CTE, which is how the brain looks. My question is, how many people look like they have CTE and are actually fine? That we don't know. So the behavioral manifestations that the family they were asking questions separately about the loved one, saying, well, did they have signs of dementia? It wasn't 100%. So CTE in terms of what looks like under the slide of a brain may not equate to necessarily having severe neurological deficits.
But numbers like this can also put a focus on this condition as well.
Yeah, I think this is going to be great press and great research to further push this on, to say who should and shouldn't play pro football, because we're not going to stop it, obviously. I think the game's going to continue to go. It keeps growing. But how can we stop the damage, and are there alterations we should do in their helmets, or the rules? Is there further things we need to take in advantage more than the concussion? So, yeah, I think it's going to be a huge bonus. This data is going to be a huge bonus for the NFL to try to help.
That's Dr. Rob Dickerman from Neuro, Texas.